guys, just wanted to do a really quick video to review the things you need to know for the exam on Chapter 7. So this isn't really a comprehensive review of Chapter 7. Chapter 7 is important and it is sort of sprinkled throughout our entire course. This is just for the exams on Chapter 6 through 9. So first up, we're going to talk about our infants and toddlers. And the separation anxiety, that's the anxiety they have if you remove them from their caregivers or whoever they're most bonded with. So um, they would have anxiety, cry, get really upset and agitated. How can we avoid that as EMTs? Sometimes we can't. Let's say there's an MVC and both the mom and the child are a victim, then you have to separate them to go to separate facilities or in separate vehicles. But if you're responding to a call in the home of a sick infant or toddler, then we can avoid separation anxiety by leaving them together as much as possible. So we can do all of our assessment. We can start off doing our assessment from across the room, and we're going to talk about this in pediatric emergencies, but we can do what we can just by looking at them. Next, we can do the least invasive things and move to the most invasive, like blood pressure. And we'll leave them seated on their parent's lap while we're doing that. And then when we need to transport, we can bring the parent if that's possible, and we can keep reminding the toddler, look, mommy's right here, or daddy. Next up is the anterior fontanelle. I have a photo of it here. Remember we talked about in class how the cranium is really divided into plates, and these sutures connect them together and they start fusing between 10 and 18 months. So this fontanelle, this diamond-shaped fontanelle, this is the anterior fontanelle. There's a posterior fontanelle back here, but we never really care too much about that. This is open to allow for the brain to grow because this infant toddler development is when there's the most growth in the brain. If the cranium was fused at birth, the brain wouldn't have any room to grow. So once the brain growth has been accomplished, the sutures start to fuse together and that fontanelle disappears. We do use this as an assessment tool. We'll learn about later on in pediatric emergencies, but what we look at is it's one of the signs of dehydration. We would never think someone is dehydrated because their anterior fontanelle is a little sunken in if that was the only thing. We also look at when they cry, do they have tears? Are there mucous membranes in their mouth? Are they dry or kind of tacky, or are they moist? Look at their skin and ask the parent about the diapers, like if they had normal urine in the diapers. So we look at all of those things, and then we to consider if an infant or toddler is dehydrated. But for this chapter, we just need to know that they fuse or close between 9 and 18 months. Next up, stranger anxiety between 10 and 18 months. So if you were going to a call, the toddler might be really anxious and worried about you because you're a stranger. They could have anxiety, kind of really cling on to the parent, and this is because you're a stranger in their home. Next up, we're going to talk about the elderly. So cardiac is first up. The cardiac system, the thing that plagues it the most in the elderly or the aging human is atherosclerosis. So as there's fatty plaques are deposited throughout the blood vessels, it narrows the diameter, and it can cause high blood pressure as the system. It can cause high blood pressure, which can be taxing on the heart because the heart has to pump against that pressure. So just to give you an idea, here's an artery, and this is just a little bit of plaque, but you can still see we have a big diameter here. This is an artery with a little bit more plaque, and as if this was all over the body, then we would see an increase in blood pressure because we've narrowed the diameter. This is what we're going to talk about in cardiovascular emergencies, but this is a plaque that's ruptured. So when the plaque ruptures, um, the platelets all group together. Remember, we talked about this when we talked about aspirin. When there's a cut or some kind of bleeding, the platelets signal each other. The angry platelets mob together and form a soft clump, and then later fibrin is deposited through to make it a clot. That's why we give aspirin as soon as possible, because we don't want the platelets to form those soft clumps. And you can see once we've added the platelets on the ruptured plaque, we have a really narrow diameter now. And if this is a coronary artery that's delivering oxygen and nutrients to the myocardial cells that are pumping the blood around the heart, they're not going to get enough oxygen, and it can really damage those cells. So as an EMT, what we do is try to recognize, first of all, recognize as soon as we can the signs of chest pain of cardiac origin, and we take the patient as soon as possible to a facility that can do some intervention here and clear out this plaque and increase this diameter. And we can give aspirin, and we give aspirin to prevent the platelets from being sticky or platelet aggregation. So atherosclerosis, this can cause high blood pressure, heart failure, and then those ruptured plaques can cause a stroke or a heart attack or myocardial infarction. Next up, renal. Another word for this is kidney. So the kidneys they balance our fluid. So if we have too much fluid, they excrete it, and they also clear out waste. So they really decrease in their ability to clear waste and conserve fluids or balance them out. Let's take a quick look at our kidneys. They are retroperitoneal. So they're on the posterior side of our body. And this is just a real basic review of what they do, but these calyces here are going to filter out the toxins, and they're going to really balance how much urine they're going to release or fluids. The fluids and the waste go into these tubes here. This is the ureter. It drains down into the bladder, and then it's excreted in the urethra. So our kidneys of the aging, elderly, they have decreased function. So they decreased ability to clear the waste and to balance and conserve fluids. And then last up is endocrine. So the endocrine system, the thing that impacts it the most is diabetes, type 2 diabetes. So decreased activity, this could be from being tired or having arthritis, having physical limitations. So they're not moving around and exercising as much. They develop weight gain, and this can lead to diabetes. There's also genetic factors. It is very complicated, but this is the most common path to diabetes in the elderly. And then last but not least is terminal drop hypothesis. This is when there's a presumed decline in mental function in the last 5 years before death. So just before 5 years before death, maybe there's some cognitive impairment, so maybe slower thinking, maybe dementia. And this is just a hypothesis. Not everyone really believes in this, but it's just something that's presumed. And that's all for this Chapter 7 review. As always, email me if you have any questions.